My name is Sharvin Tagavi, and my co-investigator, Juan Duchesne, and I are from Tulane University School of Medicine in New Orleans, Louisiana. We will be conducting a multi-center trial examining pre-hospital procedures in penetrating trauma patients. The data is clear that pre-hospital procedures can be beneficial in traumatic brain injury or when transportation is prolonged, such as in rural settings. However, data is less convincing for penetrating trauma. In urban cities like Philadelphia and Boston, there is never a trauma center too far away from pre-hospital responders. Retrospective data suggests that in this setting, with penetrating injury in urban areas, transport to trauma centers should take precedence over procedures such as IV line placement and endotracheal intubation. In addition, with new ACLS guidelines prioritizing uninterrupted chest compressions over advanced airway, it is time to re-examine the role of advanced airway in trauma patients, along with other pre-hospital procedures. Despite these findings, pre-hospital procedures are still being carried out in the field in penetrating trauma patients in urban locations. The negative effects of pre-hospital procedures may be related to time and delay in surgical control of life-threatening bleed. However, both clinical and animal studies have shown that pre-hospital procedures can actually cause physiological changes that are harmful. For example, endotracheal intubation can exacerbate malperfusion of vital organs in severe hemorrhagic shock when bleeding is uncontrolled. The specific aims for this study are as follows. Number 1, to determine if penetrating trauma patients with pre-hospital procedures have a survival advantage over those without pre-hospital procedures. Number 2, to determine if penetrating trauma patients that have pre-hospital procedures have decreased morbidity. And finally, to determine if patients brought in by private vehicle or police transport have better survival than those brought in by medical transport crews, such as BLS or ALS crews. Our hypothesis is that for penetrating trauma patients in urban locations, those that do not receive pre-hospital procedures will have better outcomes than those that do receive pre-hospital procedures. The inclusion criteria for the study will be as follows. Patients with gunshot wounds and/or stab wounds to the torso and/or proximal extremity known to be age 18 or older. The torso will be defined as the area between the clavicles and above the inguinal ligaments, pubic symphysis, and gluteal folds. The proximal extremity will be defined as the extremity proximal to the elbows and/or knees. Number 2, patients with torso and/or proximal extremity penetrating injury combined with the distal extremity injuries. And finally, patients with penetrating torso and/or proximal extremity injury combined with a blunt injury. The exclusion criteria for the study will be as follows. Any injury above the clavicle, including the head or any neck injury. Patients with traumatic brain injury will be excluded from the study. Patients with distal extremity injury only, so injury distal to the elbows or knees. 3, patients with isolated blunt mechanism of injury. 4, any transfers from outside institutions. And 5, patients age 17 or younger. Please contact us if you're interested in participating. We hope to talk to you soon.